Anyone living a happy life can be influenced by drugs. The drug we are focusing on is fentanyl. The company Janssen Pharmaceutica first developed it in 1959, and it was primarily used as an anesthetic and pain reliever for medical purposes when it was first introduced. During the 1960s, it started to be used as an intravenous anesthetic, and it was called Sublimase. It wasn't until the middle of the 1990s when the fentanyl patch was introduced and could be used in the treatment of chronic pain, such as pain from cancer. After the patch, other ways of delivering fentanyl were introduced, including the active lollipop and other oral options. Most fentanyl in the US comes from China. China isn't where fentanyl originated, but because of the lack of regulations in the pharmaceutical industry there, the country is a pretty significant supplier of illegal prescription drugs and chemicals. Fentanyl is 50 to 100 times more toxic than morphine. 1,109 drug poisoning deaths in Canada with toxicological screening indicating the presence of fentanyl. There is a 2,000% rise in street drug samples testing positive for fentanyl. The drug slows down the message traveling between the brain and body. This drug is prescribed for chronic severe pain as a result of cancer, nerve damage, back injury, major trauma, or other causes. Fentanyl is available in many forms. Pharmaceutical fentanyl is used for managing acute or chronic pain. If the dose is too high, you might overdose. The effects of taking fentanyl with other drugs, including over-the-counter or prescribed medications, can be unpredictable and dangerous and harmful. While in a medical setting, fentanyl can be effective and safe for the treatment of severe pain, when it's used illegally it can be incredibly dangerous. There are more than 12 illicit types of fentanyl that are known currently. If you or another are using the drug, never use the drugs alone. If you're using it, start with a small amount. Do not mix substances, including alcohol, as it increases risk of overdose. Call 911 right away if they think someone is overdosing, and make a plan and know how to respond in case of an overdose. Some examples are fentanyl and alcohol, which adds to adverse effects and may increase the risk of respiratory depression. Fentanyl and Maui antidepressants together can result in severe unpredictable reactions. Fentanyl and benzodiazepines may add to the sedative effects and diminished breathing. Since the effects of this powerful drug are short, it is more addictive and there is more of a potential for it to be abused or for someone to overdose on it. Although many people who choose to take it on their own take it incorrectly, doctors know how to inject it safely if it's prescribed. There is a way to safely take this drug. There are safe injection sites that can give drug users the opportunity to take the drug safely. This is a legal sanctioned, medically supervised facilities designed to reduce nuisance from public drug use and provide a hygienic and stress-free environment in which individuals are able to consume illicit recreational drugs intravenously. Basically, this means that people can go to these sites that have clean supplies, healthcare services, and have staff to prevent others from overdoses. Fentanyl is an unsafe drug that can harm you and those around you. Some of the effects of this drug are dizziness, nausea, and depression.